To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we are talking lung cancer. I am joined by Dr. Scott Parrish, a pulmonary medicine physician with Fox Valley Pulmonary Medicine and affiliated with ThedaCare. Hello, doctor.
Hey there.
Well, we are talking about lung cancer today, and maybe you could begin by telling us who is impacted by lung cancer the most, and maybe some stats.
So if you exclude skin cancer, lung cancer is the second most common cause of cancer in men and women in this country. It primarily occurs in older people. The average age of diagnosis is 70. It's unusual to be diagnosed with lung cancer earlier than age 45, although I have seen it. And it's the leading cause of cancer death in this country. It actually exceeds cancer deaths by prostate, breast, and colon cancer combined. On a positive note, the number of cases are going down because people are smoking less, and the number of deaths due to lung cancer are going down because of better treatment options and early detection.
And we want those numbers to go down, so let's segue into some of those risk factors. What are things that we should really look out for?
So there are certain modifiable risk factors and others that are not modifiable. The biggest risk factor is smoking. About 80% of lung cancers are associated with smoking. For the subtype small cell lung cancer, that is much higher. Other things that can put you at risk of lung cancer are things like radon exposure, asbestos, exposure to other carcinogens, and even exposure to radioactive ores such as uranium. Things that you can modify, obviously, is smoking, avoiding secondhand smoke. Things that you can't avoid are things like a personal history of lung cancer, a family history of lung cancer, or if you've ever had any radiation to your lungs.
And that probably brings us into the screening process, right? And there have been some changes, so maybe you could update us on what that screening procedure looks like.
Sure. So this has been a very important development for lung cancer detection and treatment. The procedure that they do to detect lung cancer early is called a low-dose CT scan. And this really allows us to detect lung cancer before it's symptomatic. By the time people develop symptoms from lung cancer, it typically is much more advanced and much harder to treat. So currently the United States Preventive Task Force recommends that for people between the age of 50 to 80 who are still smoking or quit less than 15 years ago and have the equivalent of a 20-pack year history. And by that, I mean the equivalent of 1 pack per day for a year. So somebody will have a 20-pack year history if they smoke 1 pack per day for 20 years, or if they smoke 2 packs per day for 10 years. And so I think if you feel that you want to be screened, and you should talk about this with your doctor, and if they feel it's appropriate, they'll put an order in.
All right, doctor, thank you so much for helping us through the lung cancer awareness, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.